Okay. Okay, the recording is on. So as I was mentioning, this call really came about because we saw in times of mass care needs and emergency response over the last few years, whether it be wildfires, extreme weather events, smoke events, all of these different scenarios, faith-based organizations are really oftentimes the center of community response, and working in parallel to a lot of the state and county and federal response. But in too many cases, there wasn't enough communication or collaboration, and that can cause some unintentional outcomes, whether it be survivors of these events not being able to access all available programs, whether it be undercounting or missing folks who might be experiencing loss as a result of an event, not adequately measuring the impact of an event. And so this is really intended to be the start of a series of conversations for us to learn more about the work that each of your organizations is doing in the event of emergency and mass care, and also to learn what some of the resources and programs on the state, federal, and county side happen so that we can be more effective and efficient and reduce waste in times of need. So again, this is just the start. And with that, I'm going to go ahead and turn it over to Chad Knowles, who's the Deputy Director of Office of Resiliency and Emergency Management. And we will go from there. I will be monitoring the chat box. We will be recording this, and we will do lots of follow-up afterwards as well. So feel free to use the chat throughout the presentation. Chad, over to you.
Thank you, Maria. I appreciate you. Thank you for the introduction. I'm super excited to be talking probably for the first time to the faith-based organizations in this capacity. This is a very important part of our basically, the faith-based organizations have been an incredibly important part of mass care across the state, and a huge amount of issues and hazards that we've actually seen across the state. So one of those things that I wanted to make sure I mentioned today was thank you. You do wonderful work, and as I look back in the 2020 wildfires, I will say that the organization that you see in front of you is called, as Maria mentioned, the Office of Resilience and Emergency Management. We didn't really have much of a mass care capability as far as people running that show. At the time of the 2020 wildfires, we had about 1.5 people dedicated to the mission. Now we've grown considerably since then, because obviously, as we saw in the 2020 wildfires, it impacted several counties. 12 for sure, and then more as we went through it. And the amount of organization, the amount of tasks to be performed, and as a mass care lead in the state of Oregon, because that is what OHDSS has been charged to do, is be the lead organization for mass care during incidents. We also know that we can't do it by ourselves, and the key piece to this whole equation is that it's a team effort. We actually have 15 supporting state agencies that help with mass care, to include additional adjunct agencies, similar to that you would probably recognize as the American Red Cross, Salvation Army, and so forth. But more importantly, also the volunteer work and the donations and donation management that we'll get into a little bit later in this brief, that the faith-based organizations do. And it was just a wonderful experience to actually work with a lot of the faith-based organizations during the 2020 wildfires. But we also knew we had a huge learning curve, and also the coordination piece needed to happen. That said, if we can go ahead and start the slides, I'd probably want to start getting into this. As Maria mentioned before, please jot your questions in the chat, and we'll see if we can't get to them as soon as possible. Again, next slide. So as far as our guiding principles, What we found, especially in the 2020 wildfires, is that incidents disproportionately impact some of the communities. All efforts need to be equity focused. And you will see if you were to go down to Jackson County after the 2020 wildfires down there in basically your Medford, Talent area, you would have seen a considerable amount of people suffering because of those fires. And we lost over 1,500 of those were mobile homes, which is an interesting demographic in and of itself. And how do you rebuild those things? It seemed like it was disproportionately affecting those that may have been lower income and so forth. The next thing is the emphasis of communication with survivors in linguistically and in culturally appropriate ways. And then partner with local jurisdictions and community-based organizations that are best suited to support the needs of the survivors. So those were our guiding principles going through the majority of all the incidents we've actually had or have occurred in the past 30 months. Next slide, please. As we prepare for responding to emergencies, we have actually been given some direction to make sure that we take care of and use certain ways. And number one, using of data to locate and prioritize the highest need communities during a disaster. Also, continue to feed and shelter during a disaster to make sure that the basic needs of individuals that are suffering from an incident can be met. Now, keeping in mind, and we'll talk a little bit more about this later in the seminar series about Maslow's needs. The base needs are basically, do they have a roof over their head? Do they have food to eat? Do they have direct security? Can they sleep? Those types of things. These are things that we need to actually be able to provide in those times. And this is going to be a wonderful discussion here as we go through this seminar series. Also partnering with our tribal affiliates, as well as the nine tribes here in the state of Oregon. We do have actually, and I'll show you in a little bit later in a slide deck here, we actually have a tribal emergency coordinator that works directly with the 9 confederated tribes here in the state. Very important part of the equation that we didn't have in the 2020 wildfires, but we were able to gain during our process in actually increasing our team. Additionally, working to prepare for the Cascadia earthquake. That's the big one, as everybody already understands. Obviously, that's a monumental undertaking to make sure to be prepared or more prepared for that event. But that's what we're geared toward, because once we gear toward that, then the other pieces, the other events don't seem as difficult to achieve. Next slide. As we look at ourselves as the Office of Resilience and Emergency Management in OHDSS, basically OHDSS, number one, on the far left, you'll see the OHDSS programs and staff. We do not have to have a declared incident in order to take care of the people that fall into this category or that are taken care of by OHDSS. We do actually have about 1.5 million people that we care for in the state of Oregon that are more vulnerable as a population. And we do not actually need a declaration for that purpose. So through our processes, we are able to actually render aid and mass care services to those individuals in need. Those would also include like public safety power shutoffs and basically electric outages, to include warming centers, cooling centers. As you look into the second one, we did in 2021, legislature made OHDSS the lead agency for cooling, warming, and cleaner air centers across the state. So that said, that is another mandate to OHDSS to do. And we actually have been performing that role since that's been, in fact, even before that, we had been performing that role. But now we have the actual mandate for that. As we get into the right-hand side column, this is when an actual incident is declared. A state declaration is moved, OEM is actually stood up, and then of course we become what some of you already know what mass care nomenclature is, but the Emergency Support Function 6, which is mass care. That's when we stand up as OHDSS as the lead for mass care in a statewide emergency. And it could be a local jurisdiction that has the emergency, and it could be a state declaration for that jurisdiction. But at that point, we have additional, I would say we have different additional resources to go ahead and attack that problem. Regardless of what level this comes in, regardless of what manner in which an incident occurs, we are always looking for partners and sustaining members to help us out in these events. And you've done a wonderful job up to this point. And again, it should be applauded for every effort that has been made. Going to the next slide. So a couple of the options or the operations that we're doing, this is not an all-inclusive list, dealing with fire, ice, drought, heat, pandemic, refugee resettlement, and others. We're currently doing quite a few of those. In fact, we are still taking care of quite a few individuals that are still recovering from the 2020 wildfires at this time. Next slide. This slide actually kind of gives it, and it's kind of hard to read. I do apologize for this slide. It's a little harder to read on the darker font, but what can we provide? What are we doing? Well, building partnerships is very important through emergency management, the different agencies, public health, community action agencies, coordinated care organizations, 211, which we actually have that contract for 211 statewide. So in the event of a cooling and warming center that needs to go up and we have a request through the county, we're able to actually activate 211 to help with the coordination and communication of that event. So very important. American Red Cross is one of our one of the really important partners in mass care. As you can imagine, they're everywhere and their volunteers are everywhere. And they do a phenomenal job, not only just in support of an incident, but also for training prior to build that resilience in each of the communities. So we lean quite a bit on the American Red Cross as far as their training, their expertise, as well as in other things during an incident. Other ESF partners, and of course, as mentioned before, faith-based organization being considered a non-government organization, and then of course contracted mass care partners as well. Next slide. So I just wanted to kind of show you this map, and this is the state of Oregon, obviously kind of blown up a little bit. We've actually broken up the state into really 3 geographic regions for ourselves. We have 3 regional emergency coordinators that have geographic locations. We have the Northern Rec, which is basically Jeff Gilbert. He's the one that is in charge of that Northern Rec, as you can see, or that region. To the south, we have Amber Rawson, who is the interim regional emergency coordinator that basically takes from Lane County south. And then this also goes all the way to the west, to the coast. Then when on the other side of the Cascades, we have another regional emergency coordinator, Corey Jones, that takes care of all of that area on the east side. To help them, each one of these regional emergency coordinators have a social service emergency liaison that's able to plug in to the local area. Specifically the counties. They're in charge of a certain amount of counties, and they'll be able to plug into the emergency managers at the county level to help them make sure that they're good to go. Below that, we also have mass care liaisons, as well as disaster case managers that help quite a bit. So I just wanted to show you that. And then of course, our really important member of our team is the Tribal Regional Emergency Coordinator, Eli Grove, who basically doesn't have a geographic location, but is basically oversees the 9 confederated tribes in the state of Oregon. Next slide, there we go. And as far as our roles in emergency operations, in the operations plan, when it's activated, when there's a state declaration or incident actually meets the criteria for an emergency, you'll see that OEM will stand up their emergency coordination center. All of the Emergency support functions will stand up, and us as ESF6 will stand up as mass care, and we're probably already moving. We're already moving into this incident. We don't necessarily wait very long before we stand up. That said, I just want to kind of go over some of the things that we would actually be very, very interested in. Of course, our mandate is sheltering, feeding, first aid, distribution of goods, information, water, as well as emergency assistance and reunification. Very important parts. And as you can imagine, if you have a large enough incident, it could actually be an incredible amount of work. That's why it's going to be so important to make sure that we have a good cultivated relationship and coordinate with all of our partners, especially the faith-based organizations. As Maria just indicated, she, prior to me getting on, really faith-based organizations were the original social media. They were where everybody goes to get information, to get together, to coordinate, and so forth. That is an incredible reinforcement to activities such as a hazard or a disaster. So we very much are willing and wanting to coordinate with you to make sure that we can get to a more coordinated realm and make sure that we're more efficient and that we reduce any kind of waste or duplication. And then next slide. And what I want to do is kind of go over some of the key pieces in a little bit more specifically when it comes to what I see currently. And I know this is not an exhaustive list, but what I see currently as where would we want to go with some of this seminar. First one would be shelter and feeding. How do we become a shelter? And what kind of shelter would it be? Congregate and non-congregate. Congregate sheltering is an open, larger space. Non-congregate is kind of like, if you, an example would be a hotel room or an individual room with four walls. That would be a non-congregate. So taking a look at that, those are the different types of sheltering activity, congregate and non-congregate. Also feeding, meals, snacks, and water. And then, of course, any of the distribution that goes along with the sheltering and feeding. Very important part of this. I do believe that a lot of you have already been doing this type of work. And maybe there are some of you that would like to actually engage in this work, but didn't know how to do it in the first place. And so the next set of seminars would actually be specifically to hone in on each one of these types of capabilities. And if you'd like to actually get more training, resources, or whatever the case is to do this type of work, that's one of the reasons why we're here. Next slide. Next one is respite centers, warming, cooling, and cleaner air. Centers may be established within local communities to provide a short period of relief from a temperature or an air condition. A lot of times with wildfires, what you'll find, especially in certain pockets of Oregon, the air quality index will shoot up considerably and create a very harmful, I would say, breathing environment. And so some of your more vulnerable populations could be impacted severely by that. What we have been able to do is actually open up these warming, cooling, and cleaner air centers in order to provide somewhat of a respite from that condition. It's very important to understand that there are certain requirements, there are certain things that we'll need to do in order to actually set that up. And again, we'll go ahead and talk about that more in other seminars. Next slide. I wanted to put this slide in here and just to kind of make sure that everybody's understanding the difference between a congregate shelter and a respite center. If you look at a congregate shelter, a shelter is it's more involved, right? As you take a look at it, this will actually include, not only is it giving you a location to reside from the outside elements, but it also gives, it's typically 24/7. And it also gives a dormitory, medical services, potential behavioral health, spiritual care, initial recovery casework, and potentially co-located shelter or pet shelter. As a respite center, that's a little bit lower bar, if you will. It's really not typically a lot of our respite centers don't actually go 24/7. In fact, it's either at night or in the day, depending on what element we're trying to shield from. And again, may only be open part of the day. So that's the difference between a center. And then there's a lot fewer resources. Okay. Was that my hint, Maria? Thank you.
That was purely bad button
You
management.
know what? I appreciate that. Next
You're doing
slide.
great, Chad.
Thank you. I'm trying to stay on time here, Maria. Anyway, we're good to go. Thank you. Now, one of the things you may not be aware of is what we call a temporary evacuation point. Now, a temporary evacuation point is a very important piece of an evacuation plan. When, say, for example, let's just take a look at the Cedar Creek or even the Rum Creek fire that was down in Lane County. Well, actually, it was down in Josephine County. Basically, what it came down to is this. They had to get out of the location so fast in Lane County for the Cedar Creek fire. That whole town had to evacuate, but it was all at once. And it's very difficult to set up a shelter and kind of triage all these individuals that are coming in at the same time. And so it's set up a temporary evacuation point. And at a temporary evacuation point, at that point, you're actually really functioning as a kind of an information center. And then you will go ahead and inform those individuals where to go to get certain resources and services. So that's a very important part, and one that we haven't really stressed much with our non-government organizations, but I'd like to open up that opportunity. So those temporary evacuation points become very key, and that communication is really important, and that information flow is going to be incredibly important. So just wanted to mention that. Next one. Points of distribution. This is not necessarily a shelter. This isn't a shelter. This isn't a respite center. This is not a temporary evacuation point. This is a point of distribution where certain goods and services, goods would come in, sorted, and then be dispatched out to potentially a variety of different functions. This is an opportunity for certain non-government organizations to actually do that kind of work. It doesn't necessarily have the direct link to the survivor or that individual that's evading that harm, but it does actually give an opportunity for that for an organization to go ahead and serve in that capacity. And it's incredibly important because a point of distribution really does actually make sure that everybody has that timely resource and make sure that it's not overwhelming a shelter or a center or whatever. And that's very important to know because we can sometimes, if we give too much all at one time, it could be more of a liability than an asset. So I just wanted to make sure that this is a really important one. We can go into this more as well as we go on through the series. Next slide. Resource centers. Now, this is actually very important as well. What do we need a resource center for? This is really information, providing information to other resources, similar to a temporary evacuation point, but a resource center may be where a family can go to understand what was happening. They may be from out of town, whatever the case is. It's kind of a one-stop shop for private organizations to come together to provide assistance for those affected by the disaster. So it could actually have certain elements like childcare, could also be pet sheltering and other types of resources. This is actually kind of an open book. It doesn't have to be everything, doesn't need to be all inclusive. What it does do is it gives more options to individuals to go to versus just going to a shelter, just going to a center. It gives them more. So another option. Next slide.
Chad, one thing I wanted to add that I should have caught when we were creating these slides but forgot is resource centers are also a point where chaplains or other mental health first aid practitioners that are oftentimes clergy or other faith-based volunteers are trained to provide that type of assistance when someone experiences loss or crisis or emergency situation. This is also a space where those folks might be present to render aid to individuals who are survivors of a disaster.
Absolutely. Thank you, Maria. That was a great comment. Thank you so much. And we'll go into more of these as we go through some of the more specific trainings. And that was a great point. Appreciate that. The next one is, a lot of you have already been doing this, pretty much all the time. Donations and donation management. This is solicited and unsolicited donations. The receiving, the tracking, the distribution, and packing, all those things that are part of that equation. And this is one that I would really like to get more involved with to make sure that we understand. Now, keeping in mind, we're not the only agency that does this type of work. We're just one of those that really cares about how it's distributed, because of all the different functions that we have for sheltering centers and so forth. It's very important to make sure that we get these things right, and it's well trained. A lot of the faith-based organizations I've worked with do this better than I could do it. But there are certain organizations that may want to start doing this more. And there's a different training to actually do that. And so we have lists, checklists, and so forth that help considerably. Not to mention the communication that's involved with donations and donation management. And then the amount of work that needs to go into it. What's acceptable, what's not acceptable. These are all pieces and parts of that training. Next slide. And I will say right now that I've asked Maria to send out a lot of messaging about this. Volunteers, recruiting and tracking. Volunteers are absolutely always welcome. They are. Now, keeping in mind, there are certain centers, shelters, and so forth that may require a little bit of a class, maybe some just-in-time training to actually, volunteer and so forth. But by and large, they can do a lot of wonderful work. Don't actually have to open up your own shelter. You don't have to open up your own center, but your congregation can volunteer for some of these shelters or centers that are already open. And so we have the opportunity to actually do that. And a lot of the counties have Sign Up Genius, that type of program for online, where you can go in and say, okay, I'd like to work this shift and go do that. And that's really great. And so we're actually able to actually point to those websites, make sure that you guys have that information, so that if you do have somebody in your congregation who'd like to volunteer and they need to know the requirements or whatever the case is, we give that to you freely. And we certainly look for it. This last week, as we went through the warming centers in Multnomah County, a lot of you may have already had experienced that. We had seven warming centers operational in Multnomah County alone, not to mention the ones in Josephine and Jackson County. And so there was a lot of opportunities for us to actually serve in that capacity as a volunteer. Now the counties opened up the centers. It was just a matter of how do we staff these centers. And so volunteers will be a good seminar to actually be part of it as well. Next slide. So going into communication tools, I think this one is going to be a very important seminar for everyone, regardless of what you're looking to do as a congregation, as a faith-based organization. The communication tools and what's next, right? So we have what we can do, and what we'll do in this seminar is talk about PACE planning. PACE planning is an acronym. It stands for Primary, Alternate, Contingency, and Emergency Communications, and how to actually plan for that. Because in the event of a power outage, what communication do you have? Do you have backup generation? Do you have a different type of radio? I know of a lot of organizations that have, for example, ham radio licenses and networks in their own organization for those ham radios. How do we tie that in, and how do we actually benefit by and large as a state from having those organizations up and operational and also communicated? And then also taking a look at communication flow. Who are we talking to? Who else needs to know? What does it look like? How do we actually go ahead and get a hold of somebody? Are there lists? Are there communication lists and so forth? Then, of course, the communications training. Very important part. And I think this is, like I said, it's going to be very important to go through this seminar series. And then taking a look at what gaps and needs do we have. Once we actually understand, generally speaking, what we probably should have, what are those gaps? What are those needs? How can we fulfill those? What barriers do we have? We'd be very interested in seeing that, and making sure that we can get to some kind of resolution at a given point. So that said, the communications is very important. Let's see. Are there any other questions here before we go on to this next one, Maria? I saw some chat questions.
Yes, there are a couple of questions.
Okay.
Since we do have a few minutes, do we want to get into questions now before we talk about the survey, or what order do you want to do that in, Chad?
Well, let's go ahead and do, because I just went through pretty much the seminar series of what we're looking to do more in more specifically. Yeah, let's talk about the survey really quick, and then we can go into the questions.
Okay, fantastic. Yeah, and just as a review before we get into survey, so those last series of, I think it was 6 slides that talked about volunteers, donations, sheltering, all of those different areas. The goal of this session is really to give a high-level overview of, okay, we've identified these handful of areas that we know there's significant overlap in the work faith-based organizations do, the work that state agencies and county agencies do. How can we do better at building capacity and improving efficiency by working together more closely? Not to supplant or to take over or augment anything you're doing, but instead just to enhance and build capacity so that we can best serve Oregonians. And so these next survey questions are really trying to capture some of the information and interest from each of you so that we can best craft these next more in-depth trainings, capacity buildings, and conversations with each of you in these areas. So just a little bit of a background to summarize where we're going with that.
And Maria, you hit it right on the head. Really, really good. Very important. It's important to know that absolutely supplanting those efforts would be a huge mistake. We don't have enough resources to go ahead and do that. We just don't. And this is going to take the whole mass care family to really make it work. And if we can just, coordinate a little bit better and make sure that our resources are actually being used in proper ways, I think we're going to really do a lot of good for all the Oregonians that we're serving. And the other piece to that equation is this. Even though an organization might feel really anxious and excited about helping the first week or two, remember the 2020 wildfires. It went on for a long time. There was people displaced for a very long time. And I know that there's organizations that if they just had one more resource, or if they just had a little bit of assistance here or there, they could have actually added more time to their service. These are the types of things we would love to actually understand. And we actually did coordinate and help some of the organizations that were doing phenomenal work in that process, in that 2020 wildfires, because we didn't want it to stop. It was actually doing they were doing a very important role. And we wanted to make sure that they had the capabilities to continue. So that's very important to know too. So taking a look at our survey 1, 2, 3, as Maria talked about this is really just, hey, what have you done in the past? What would you be interested in doing if you had the resources, training, or whatever the case is in the future? And then also taking a look at what barriers are you seeing right now? What's stopping you from going to that next level? We'd be very interested in knowing that. And then, of course, if you take a look at that as far as what training would you like to actually see in these future seminars? As we'd mentioned, there are quite a few of them that are coming up. We've already kind of set some of them, but we're definitely willing to adjust certain things just to make sure that we're getting to the right information for you. So your feedback is really important to this. Additionally, taking a look at it as we're looking at who do you actually work with? Who are you contacting? I would imagine there's quite a few, even local jurisdictions that probably don't know how to get a hold of your organization, or vice versa. Who are you contacting during an incident? how are you contacting them during an incident as well? Those are the types of things we're looking at here, just to kind of edify or to help us understand what it looks like, the landscape. And then we can go into some of the series to actually kind of mend some of that, and maybe even broker or help enhance the communication all the way around. That said, what we have here is a link to what we call a survey 123, which has exactly these questions. And if you were to go ahead and use this barcode, or what do they call these, Maria?
The QR code.
Oh, the QR code. I'm
There's,
sorry.
I've also put the link in the chat box. So
Okay.
if you go to the chat box, you can access the link there, or using your phone to scan the QR code.
Absolutely. I appreciate that, Maria. I'm a little bit older, so I don't know.
You're aging yourself, Chad.
I know. Thank you. I appreciate that. Let's go ahead. If there are no other questions for the survey 123, we'll go ahead and go to the next slide, which I believe is our questions. And of course, Maria has her information on here with her email address, or at least to the faith liaison for DHS.
Yeah, so I'm sure this is going to probably spur a number of questions and also feedback and, hey, what about this? And I've already captured some of those in the chat box, but as those continue to ruminate, please do send me an email or give me a call, and then I'll be kind of taking all of those in and working with Chad and his team to best inform what, as he said, communication, training, learning, not just for you all, but for us. We have so much to learn about what is already happening from each of you and the organizations that you represent. And so we want to just have one place to take all of that in. Also, going back to the map Chad showed, where there's the local emergency managers, we want to support relationship building with each of those local folks. We know that we can't house intimate relationship with all of you at the state level. And so on a day-to-day basis, we want to help support relationship building between the representative for your area and your organization. So if you don't have that person's info, please also reach out, and I will, Chad, if it's okay, I'll maybe include their list of emails and the districts or counties they have.
Okay.
Afterwards, so that way it makes it easy to connect right away as well.
I love it. I love it.
So with that, go ahead, Chad.
What questions do we have? I think we give just enough time for all of them.
Yeah. Okay. So the first question is, and if it's okay, I'm going to stop sharing just so that we can kind of see each other a little bit better. The first question we have is, Washington State has created an individual assistance program that provides immediate financial assistance to residents who don't qualify for help from other agencies or sources. Grants are small, but can be used to provide immediate needs. Is there any effort on the part of Oregon legislature to create such a program and fund it? Great question.
And the answer is yes. There was actually a proposal to do that this go around. So that said, I would have to get back to you as to where that is. I'm unfortunately, they don't let me into the legislature per se. I get to stay in my office most of the time, but I do know that did actually go forward as far as an individual assistance capability. That would actually be and more to follow as to how that will work out. I would have to get back and take a look at the language of that to have better detail about it. But I do know that it did go forward.
Yes, and in the follow-up email, once we get that, I will include whether it's a House bill or Senate bill and that information, so that if you would like to track it or reach out to your legislators to advocate or provide input on that, I will be sure and include the number associated with that for engagement as it navigates this process.
Yes.
Second question, sometime this afternoon, could it be outlined which DHS, so Department of Human Services, or Office of Emergency Management functions require local government support to roll out, and which do not require cooperation on the local level?
So if it's a state agency, it does now cooperation. So if we're actually responding to an incident, as far as actually a state declared incident, then of course we have statewide jurisdiction to provide mass care services and support. When it comes down to a local jurisdiction, in the event that it's not as big and it may not actually rate a state declaration, there are certain things we can do, but it's more limited than if we had the full state declaration. I hope that it makes sense to that. We will, however, we have quite a few activities that are happening that we do support that don't actually fit under that actual emergency, but it is part of our mass care realm that we do assist with. But we have our hands are somewhat tied when it comes to that, because we want to make sure, because keeping in mind, and you'll hear this from OEM as well, is that incidents start local and should end local. So whatever the local jurisdiction can actually provide for themselves, they should. And then state is there to augment. And it's very important to understand that thought process. Just to let you know, I'm just gonna say it outright. The majority of the counties don't have a mass care section, if you will, in their emergency management team. A lot of times they only have one person as their emergency manager, and they don't have many staff at all. And so they don't have a robust team. So a lot of times what will end up happening, if an incident does get to a certain point, that mass care or that emergency manager at the county level will actually send up a request to OEM. OEM, if it is a mass care thing, if it's a mass care need, then they will push it to us to see if we can actually support that. And by and large, for the most part, we have been able to do so. And so even though we're somewhat constrained, we don't have the full force of all the resources and so forth, we do have quite a few that can actually help out. Hopefully that
Double
was
mute.
answered.
Yeah, that was great. Double muted myself there. Sorry. Okay, next question. I have a sense that there is not enough staff capacity at OHDSS, Oregon Department of Human Services, to help all warming and cooling shelters. It seems to be the case where I am in Jackson County, Ashland specifically. There are shelters always struggling to get volunteers or other staff, and the OHDSS case managers are reportedly pretty overwhelmed by workload. Any thoughts or feedback on that, Chad?
We actually were able to support with about 5 of our staff members, our field staff members down in Jackson County during that recent bout with the cold weather. As far as actually being able to fulfill all those roles, that is correct. We would not be able to fulfill all of those roles. That's why it's so important for our volunteer network to actually really come up and help us out on that. One of the things that that's one of the reasons why I would call Maria, for example, for Multnomah County, because at one point they asked for 100 staff members. We don't have 100 staff members, even if all of us went to work all at the same time. So there's no way for us to actually do that. But with the help of faith-based organizations, the American Red Cross volunteers, we were able to cobble together enough people to actually make that a reality. It's a huge lift. It really is, especially at the time when it's very hard to get to those locations. Portland was an ice skating rink. It was really hard to even get the people there. And then how do we get the people that needed those services there? So there was a lot of work to be done with Multnomah County, and we did actually do that. But in Jackson County, by and large, I think we met at least the 5 that were actually part of that. They were anxiously engaged the whole time those warming centers were open. Again, they couldn't do it all. We can assist, and we do have the expertise to actually open a center, but we would need some augmentation. We also have what we call, we're adding to, because we do have other OHDSS personnel in the state of Oregon that are not part of the Office of Resilience and Emergency Management. Those individuals are called mass care response teams, and these are actually starting to become more and more robust as we go. And what they are basically OHDSS workers that are trained in certain capabilities of mass care, but they're really kind of a reserve. And then when something happens, we can call them up and they can actually go ahead and flex to whatever incident we're talking about. So the mass care response team is another way to do that. But even with that, the volunteer network and the faith-based organizations really have opportunities to serve in these capacities. And so this is one of the reasons why I was so excited to be here for this briefing.
Okay, next question. How does your agency connect with Oregon VOAD? Many of our faith organizations belong to Oregon VOAD and are coordinating through this organization. And this is going to be an acronym test for me. VOAD stands for Volunteers something Assistance in Disaster.
Active in
Chad,
disaster.
thank you.
Active in disaster. Yes. And I will say VOADs are just amazing organizations. I will say that this is not to supplant any of the other efforts from the other ESFs. ESF 16 is your volunteers, and when they come online, I believe right now it's Shauna Jepson who is actually the lead. It used to be Karen Lang, used to be the VAL for the state, and that office resides in the Office of Emergency Management. And again, keeping in mind that even ESF 16 is one of our partners in the mass care realm. They have their own way of doing things, and the VOADs are incredibly important. And they all have different unique capabilities, the VOADs. It's a very unique experience. I'll have the opportunity to go up to FEMA Region 10 next month, actually, to meet with some of those VOADs and work with Region 10 FEMA. But they are wonderful organizations. This is not to supplant, and it's not to stop any communication or working with any of them. This is just to really just open up the mass care, I would say, partnerships, and making sure that we're communicating properly. There are going to be some things that the VOADs are going to be asked or have asked to do, and your communication with them needs to continue. That's one of the reasons why we have that on the survey 1, 2, 3, by the way. Who are you communicating with? Because there might be some other organizations or faith-based organizations that are not talking to VOADs that need to. They give them a little bit more extra resources, potentially, direction, and so forth.
Yes, and there was a great question in the chat that I just want to highlight. If you're associated with more than one organization, please fill out the survey more than once. Fill out the survey, like we need a survey response for each organization that you're representing, because the engagement with different organizations may be different. So feel free to fill that out. One response should be relevant to one organization, if that makes sense.
Yeah.
This next question, I think, is a great conversation, and I'm going to kind of talk a little bit about how this is also applicable here locally. The question or statement is, I read an article about churches in Ukraine who have generators being the only place in town where people could charge their phones, come use their laptops, etc. It seems to me that even if each of our organizations had a generator for emergency use, we would be doing some great good for our community. I cannot agree with this statement anymore. And Chad and I have had lots of conversations. Part of what we're hoping to capture in that survey 1, 2, 3 is I hear a lot from different congregations around, we would love to be a respite center or a weather cooling, warming, smoke shelter, or a shelter, but we need a generator, or we need an air filtration device for our building, or we need an outdoor shower, or whatever it may be. We want to capture that intent because there is significant amounts of funding being requested both at the state and federal level to build capacity for those types of enhancements to improve our ability to meet the needs of all folks living in Oregon in the event of disaster. And so that is part of the information we want to capture so that we can adequately advocate for different tools, improvements, and really understand what the barriers are to help work with you to be able to do even more in your community. So the answer is yes, those are great stories. And churches, mosques, synagogues, etc., you are so well poised to fill these really crucial needs in community. We want to better understand what you need to, if that's a desire of your congregation, to help explore what that could look like and to actively look for funding and other solutions to do that. So great feedback.
Mhm.
And that really captured the essence of one really significant way. Better partnership with each of you could drastically improve our ability to respond to mass care. Chad, anything to add to that?
No, I think that's great. And keeping in mind that you may not know, as we go through these series of trainings, there might be some things that you see that, oh, well, that's a gap. That may be a need that we'll need to have solved prior to actually opening up a center, a shelter, or whatever. And then also we have those local individuals that can come out there, you know, when it's scheduled and take a look and say, okay, is this actually a good location for this to actually occur? Or what would we need to do? And then they could actually also help with a gap analysis.
Perfect. And I do see someone received an error when trying to complete the survey. Is anybody else receiving errors, or maybe folks haven't gotten there yet? Just trying to troubleshoot if this is we tested it before, but of course, technology, right? When you actually need it, that's when the problems creep up.
Right.
Has anyone else tried submitting or running into errors? Liddell, feel free to unmute. I'm not sure what you were, I saw your lips moving, but.
Still muted.
Still filling it out.
Oh, still filling it out. Okay.
There are certain things that I won't let you go to the next screen unless it's filled out, you know, with a phone number or something, right? Or an address or something in one of the boxes. So it just, it'll take you back to where that needs to be filled out.
Okay.
So that's the biggest error I have seen happen when I went through it a couple times, is that if it says required information, it's not filled out, you try to advance it to the next slide, it won't do it.
Okay, it looks like it's working for some folks and not for others. We will check it and resend the link with follow-up. Also, feel free to send me an email if it didn't work for you so that we can do some individual troubleshooting. It looks like one was about a location, and it looks like that may be different than an error code that someone sent me, but then someone else it's working for. So we'll continue to troubleshoot on our end, but I will definitely include the link again after we go through it with a fine-tooth comb once again to ensure it's working. So I apologize for any technical issues there. Okay, it is 2:58. I cannot believe we are ending on time and still answering questions, most of the questions that were asked. And as a reminder, I will be sending a link to the recording of this session along with the list of local emergency managers and some of the other resources that we promised during this call. It will take probably a couple of days for our tech folks to turn this recording into a link. So give me a couple of days to get that out to you, but we'll work on that. And then based off of the feedback, I will also be sending out kind of the topics based off of need that you all are interested in, and we'll start diving in so that we can do that work together. It will be much less of this where it's a presentation where you're listening to us, and a lot more conversation and hands-on training and dialogue to ensure that we are meeting the needs of each specific congregation. So we will get that out shortly as well. But it was really great being with all of you. Please don't be shy. And we're really excited to learn from all of you and also resource the great work you are doing to the best of our ability. So deep appreciation for the work all of you do and taking the time to be here. And we look forward to talking again soon. All right. Have a good day, everybody.
Thank you, everybody.